most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about neck pain or pinched nerve, question mark, and how to avoid surgery and pain with 2 self-treatments.
Right. Bob, there's too many times I've had patients come in after surgery and all they did was had taken some pain pills, maybe an injection, and go right from there to surgery without any physical therapy involvement. And it's like they could have avoided surgery possibly.
Sometimes they could avoid it. Sometimes it's necessary right away.
Right.
I can see that. But there's cases, I mean, I would definitely ask your doctor.
Absolutely.
Say, hey, could I try some therapy?
Right.
And they'll let you know then if it's even a possibility. But,
sure.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're not giving anything away today on Saturday, but start tomorrow again. We'll start another contest.
Okay.
I think it's the far infrared heating system.
Oh, yeah, that's a bonus.
So, yeah, that's a bonus. So you can go to bobandbrad.com or on Facebook. It'll also, the contest will be pinned to the top of the page there. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
That's right. Okay, Bob, let's go on with this. If you got that neck pain, you know, so many people are wondering, boy, it feels like I got a pinched nerve and if I did something, it would go away. And that may or may not be a pinched nerve, but one way or another, you got neck pain. But I'm going to tell you, if you have neck pain and you start to feel numbness, tingling, pain, burning, going down your arm, past your elbow, or even into your hands, it's very, very possible and very likely that you have a pinched nerve, usually up in the low neck.
Now, if you have a really bad shoulder problem, it could go down into the forearm.
Yeah.
And a very simple test for that to see if it's the shoulder or versus the neck is just move the neck in different directions like this. And if that brings on the pain, then most likely it's from the neck.
Right.
And if it doesn't, this doesn't affect it at all, then it's more likely going to be shoulder problem.
Exactly. I usually find rotation, yes, but almost
this is the one.
When you go back like that, I say, it hurts here when I do that.
It hurts there, and it might even send more pain down the arm.
Exactly. That's a very good, easy self-test that you can do.
Yeah.
So people are saying, well, what are the exercises or the treatments?
Sure.
Okay, first, before we get to them, we have to address this. We have to address posture.
Yes.
Because if your neck pain or shoulder pain, arm pain came across without any particular reason, like if you fell or bumped your head or whatever, it's just a gradual onset. It's almost certainly from posture.
Yes.
Posture, sitting at the computer, driving, watching TV, head forward posture puts a lot of stress on the neck, and those nerves come off from that area, and it all works together. So
yeah, and the point is, if you don't correct the posture and you do these exercises, you're not helping because you're going to go right back into the problem.
Right.
The posture has got to be corrected or the exercise won't work.
Exactly right. So that means you can see the white on my shoulder. We need to get those shoulders back, get the head up, and really monitor this.
Remember, for every inch you move forward,
that's talking about your head.
Yeah, that's 10 more pounds of stress on the neck.
Right.
So if you got 2 or 3 inches forward, that's 30 pounds of stress on the neck. The thing is, you may not even realize your head is forward.
Right.
You may need to look in a mirror. You may need to have someone do some videotape of you or a picture of you. And you might be surprised at how poor your posture really is.
Exactly.
Because it's a sneaky thing. It develops over time.
So and actually this first exercise does address posture.
Yes,
so
it does.
You do need a chair. So here we got a chair. And because the first thing to do this exercise, you got to make sure you're seated straight. Your head is up. And this chair is really nice because the back is fairly straight. And I can go back to that, touch my shoulders to the back of the chair, and tuck my chin in, and I have good posture. And the first part of this exercise is kind of a progressional exercise, is a chin tuck. And I've had people that had neck pain just doing this after doing about 3 or 4 of them, maybe 5, things start to improve. Not always. Sometimes we have to add the next part of the exercise.
And also, I've had Brad, when they start doing this, it actually hurts the neck a little bit when we're doing
That's
these.
true.
But it doesn't make this worse.
Right.
But they it's their neck is really stiff. It hasn't been back in that good position for a
Right.
while. So don't be surprised if it actually is a little bit of discomfort.
Good point,
But
Bob.
it should be a good pain, kind of like that. It's gonna feel like it's heading towards the right direction.
Right. And this leads into the second part of this
Right.
exercise. Typically, I would have a towel roll, have people roll up a towel. So it's about like this. And we got tape on here just so it stays together. We're going to put it here and just some gentle, not pulling hard, just snug. And then we're going to let the head go back. Let's say you go back like this and it's uncomfortable. Put the towel roll there and actually lean up against the chair, relax the shoulders so you have good posture, and go back and bump into that pain. And then bump into it again. And typically what happens with a lot of people is every time they go back with the support, they go back a little bit farther. No more than 10 repetitions, by the way, at a time is my rule of thumb. And by the 10th one, it's like it feels better, a little more motion, and then try the chin tuck again. And more than likely, you're going to find that is more comfortable than it was prior to that.
Now, if you can go back like this and it feels fine, then you don't need the towel.
Right.
You can not have to use a towel. The other thing is this is not a one time a day exercise.
Right. Exactly.
This is an exercise you're going to do 6 to 8 times a day.
Yep.
I mean, really, if you're serious about getting rid of your neck pain and your nerve pain, you're going to have to put some time into it.
Well, really, it's not much time.
No, it's not much time at all.
But it's consistency because it only takes about 30 seconds to a minute to do this.
And what's nice is you can do it virtually anywhere.
Right.
I mean, I wouldn't do it in the car.
No, not driving. I did want to mention, though, Bob, that, when I transfer people and they start to do this with less pain, but it's not all the way, I'll go from this to my hands and just put your hands back there, and sometimes that works. Sometimes I skip the towel and go right to the hands. It depends on how comfortable it is for
What's
the person.
nice about the hands is you can vary where you put them. So you can put the pressure maybe up a little bit higher in the neck with the fingers or a little bit lower on the neck. And that can make a big difference on how you go back. In fact, you may want to experiment around a little bit and see which one allows you to go back further.
And further with less pain, and that's where you're going to work it. I usually find it's a little bit lower here. I always feel the bumps that come spinous processes, usually around C7, C6 or C7. You won't know that if you're not a physical therapist or someone in this field. But that's the...
I had a patient, it was a neighbor that I had seen, and he was having trouble with a certain movement, and we'd use just one finger, Brad, and found a spot, and he could turn without pain doing that. I said, just keep doing that. And I'm going off on a tangent here. Sorry about that.
It happens.
Yeah.
Okay.
Fine.
The next thing you can do, and sometimes this is all we need. The first exercise.
Yeah.
Sometimes if this is not working, we'll go to traction.
Sure.
And with traction, we'll do it sitting here. Again, good posture. Always good posture, posture, posture. We mentioned that a couple of times in our videos.
Yeah.
Take that same towel roll. Now, it's going to be a little bit hard for me to do with my mic. It's going to be bouncing around. It might throw off my voice. And underneath the occiput, or the bumpy part of your head right above your neck, we're going to use that portion to...
Probably should show from the side, Brad.
Yep, good point. I'll actually go from the front.
Front first.
There we go. You can talk because my mic is getting out of position.
So he's pulling up at an angle here. Now he'll show that. He's pulling up and a little bit at an angle.
Yeah.
So, and you go by what's comfortable. Again, we're looking for, now if he's having pain down the right arm, what I often do, Brad, is grab it with just the left arm. I don't want to put any more pressure on that arm than need be. So he's going to push up. Now you can do pressure on, pressure off, or you can just do continuous pressure and see if that'll decrease that pain, especially in the arm. The further the pain goes out, the worse your neck is getting. The more the pain starts to centralize, we call it, come up more into the neck and stay out of the arm, the better it's getting. Right. So that's what, if you want to know if it's getting better, that's what you're looking for. Right. Also, the numbness. If you have numbness and tingling, like in your hand or in your forearm, if that starts to get better, with any of these exercises, it's getting better.
Right.
If that starts getting worse or the pain gets worse, it's getting worse.
Then you got to stop.
You
You're
gotta stop.
only going to do any of these if it makes progress, not if it get, there's no pain, no gain. You do not use that.
No, that's not, that saying doesn't fit here.
No, not at all.
So you're going to show traction on me now, Brad? So
Yeah, let's say that just traction is working. It's like, oh, that relieves it. It feels
you won't
good,
be able
but
to
my
hear me
arms,
anymore.
but my arm's getting too tired, which is pretty understandable. But you can have, if you have a family member that you trust, you take the same towel, lay down on a bed, and I'm going to put the towel underneath. And so if I lift up like this, you can see the ears. And then I'm going to keep the towel ends close together, but not touching because it kind of squishes up into the face. And we go back like this. Bob's glasses are in the way a little bit. And yeah, I always have my patients take them off too, but Bob, I was going to squish his glasses. I don't care. But he got them out of the way. All right, so what I'm going to do is at this point, I'm just going to pull up and back. And I may change the angle and ask Bob, which way feels better? Is it up here or what is that? Up?
No, back.
Back. This feels better.
Yep.
Okay. I don't know why Bob wasn't talking. But actually, I know why. That's a long story, though. Now I'm going to pull here, and as long as Bob says, boy, it feels good, my arm is feeling better, I'm going to stay here and pull as long as I can. Obviously, I don't want to get a backache or have any problems. When I do it to the patient, I can give maybe a minute, minute and a half, and then I got to take a break. Then I let the pressure off, and then I'll do that again as long as it continues to give good relief. And then and that's usually 3 or 4 times, and I'm kind of wore out, and the treatment's complete at that time. And that can be repeated throughout the day. Again, posture is a continual reminder. If you put it on your bathroom mirror or whatever, so that you have a reminder of that posture, because you don't want to do a treatment, get good results, and then go back to where you were because of this.
I got to say that traction felt pretty good, Brad.
Yeah, it's amazing.
It's
isn't
comfortable.
It? Yeah.
It works pretty well. So if you got someone that can help you out,
yeah,
it'll make a big difference.
Maybe I can show your wife how to do it. And she can just give you
she'd
some
wrap it around my neck and pull on it. That's what she'd do. So, all right.
Take care.
Thanks for watching.